Hello, my name is Rupal Morjaria. I'm a consultant ophthalmologist at the second largest eye centre in UK in Birmingham. I specialise in all eye conditions. So specifically, I see patients who come in with cataracts, with macular problems such as diabetic retinopathy, macular degeneration, and I perform a lot of laser in patients, including YAG capsulotomy and people who need laser for bleeding at the back of the eye. So I grew up in a country where healthcare wasn't accessible to everyone. Growing up, I realized that some of the most common eye conditions that are blinding, especially in developing countries, can be avoided from very simple procedures and maneuvers. These include loss of sight from cataracts, diabetic retinopathy, and glaucoma. These are very prevalent in some parts of the world still. So automatically I was drawn towards ophthalmology. And then I also really enjoy learning new skills, and I'm very particular. So I like the art of ophthalmology because it's a very precise science, and the surgery is also very precise. My enthusiasm for learning meant I took 4 years out of my training to do some research in Oxford, studying the third photoreceptor, which helps people with eye conditions. I was looking at people with eye conditions and seeing how certain conditions would affect their sleep, their wake, and their daily lifestyle. The most rewarding part of my job has to be when patients can see after a long time of not seeing, and also when patients have had some conditions such as vein occlusions or a sudden bleed from diabetic retinopathy, and they come to me really worried that they'll never be able to see. And after a course of treatment, when they can finally see again or drive, the relief and the happiness on their faces, it's just unbelievable. And, gaining the patient's trust again, having lost their vision and coming to someone they've never met, and then seeing the results, is really rewarding. So an advantage of being talkative also helps in my job. So I spend a lot of time discussing the patient's condition, finding out about patient's lifestyle, and explaining what they've got. I often get patients ask me, why are you asking me what I do for a job? But I think it's really important for me to taper their treatment according to what they do. So, I know that if patients drive a lot, if they're taxi drivers, they might want surgery a little bit sooner to have that better vision for because cataracts, they would really struggle with it from the glare from driving. Also people who work in accounting use spreadsheets a lot. So I like to know what people do, not just their eye condition, but everything about them, so I can decide how to treat them with everything in mind that they need from life.